Last but not least, Tharanika and myself, I attended the Wellcome Collection Decolonising Health Symposium, and what was very interesting is that it's bringing out this idea of indigenous healing and health and ideas of wellness having been displaced by a kind of colonial forthright eviction of indigenous ideas of healing. So Lindsay, as a historian, referred to the meaning of enlightenment from the Western perspective of science and logic overturning superstition and belief, and skepticism of complementary therapies, and interestingly, in Eastern ideas of healing, such as traditional Chinese medicine or Ayurveda, as their exhibition stimulated that symposium, is about symptom relief, but there is this deeper understanding about paving the road to enlightenment in terms of balancing mind, body and spirit. So that's an interesting thing. And decolonisation is about dismantling these colonialist epistemologies and patriarchal ideas, but interestingly it's nuanced. It has also this centering of indigeneity and displaced indigeneity. So in the BMJ in the last month, here is one article looking at acupuncture in a very skeptical way, and sort of a biomedical colonial attitude, the decolonising movement would say. And here, 2 weeks later, in the BMJ again, is a kind of more open-minded article on a randomised trial looking at Tai Chi. So it's an attitudinal thing. I'm going to hand over to Tharanika.
So as a medical student in medical school, we're taught this narrative that treatments are evidence-based and based on scientific logic and reasoning, but in actual fact, that doesn't seem to be true. As you can see from this diagram in BMJ clinical evidence, about half of treatments had unknown effectiveness, 5% were unlikely to be beneficial, even 3% was likely to be ineffective or harmful, leaving just 11% as beneficial, which really stresses that the need to be open to treatments that aren't necessarily westernised, sort of conventional, that might not necessarily be measured in the same way as these treatments that we think. And that's what we saw when we conducted an audit at the Whittington Acupuncture Service in the maternity department, which when we adjusted for all these confounding factors, we saw a reduction in pain, in induction of labour and delivery and postnatal length of stay, and really quite convincing physiological evidence to suggest why this might be. But perhaps the greatest finding was that it was greatly appreciated by patients and the effects on them. It added to their view that the maternity department was forward-facing and open-minded, and really their respect of that department that we saw. So both Dr Lokugamage and I are both from a Sri Lankan background where Ayurvedic medicine is as easily available as westernised sort of traditional medicine. And what we've sort of seen from this is the idea to acknowledge your own implicit biases regarding the ideas of treatment, and to unlearn those implicit biases, and that's really the lesson that we'd like you to take home today. Thank you for listening.